This video is meant to be useful for the child and the loved ones of their child and the caretakers for their child where there's been a single sudden episode of violence or of victimization. We know that there are many children, unfortunately, who live in poverty or whose parents are abusive or not well informed about how to raise children. And we're not dealing so much with the chronic condition of abuse and neglect. In a way, we're dealing with populations in which an intervention can make a dramatic difference, because these are children who otherwise have the resources in the school, in the home. They're healthy to begin with. They're normal people, and they have suddenly faced a very abnormal event. And through the use of a video to be seen in the school and in the home, a way that brothers and sisters and parents can look at something and then talk it over, we're hoping that we can help.
PTSD is the disorder that occurs after a child has been exposed to a catastrophic event, and including things like natural disasters or violence or severe accidents. And the components of the disorder, in order for it to be qualified for the disorder, then the child must have experienced extreme helplessness or horror, fearfulness during the event. Now, there are then specific types of responses that children have to a catastrophic event, including symptoms of re-experiencing, symptoms of avoidance, and symptoms of arousal.
If you want to understand post-traumatic stress disorder and stress in children, I think it would be important to first understand how the body works. And as most people know, if the body is exposed to physical stress, like running 6 miles from a rabid dog, the body tries to balance itself. The stress is the exercise of running, and the body tries to balance itself by an increased breathing and an increase in heart rate. The mind is no different from the body. The mind makes adjustments to stress, to psychological stress. And so you see very similar kinds of adjustments being made mentally, the same way you see the body making adjustments physically. So every living thing does that. A child who runs 6 miles from a dog is going to have the same physical balancing as an adult that runs 6 miles from a dog. Similarly, an adult who's exposed to an extreme stress is going to try to rebalance themselves mentally, and a child is going to try to rebalance themselves mentally. The difference is that depending on how old the child is, they're going to have different abilities to balance. And so helping that child cope depends on their age. Helping that child cope depends on their previous experiences. Helping that child cope depends on the family and how the family copes with that stress. So it's different for different ages of children.